The Supreme Court can pull Roe versus Wade out from under women, and Colorado's access to abortion should not change due to state law. But our Anusha Roy starts us off tonight with a look at the more complicated situation for women in Colorado, where abortion is one concern, and so is child care, paid leave, maternal mortality, and the list goes on.
Consider the complexity of this issue.
Mari Foster is a licensed clinical social worker trained to look at the big picture.
And people have access to deciding how their family structures look, how this then impacts our communities as a whole.
The answer is it's all interconnected, even in Colorado, where lawmakers protected the right to an abortion at a state level. We start with access to health care.
They have to drive into a next county to get the care that they need.
Christina Walker is with Raise Colorado, focused on policies for pregnant people, infants, and caregivers. Colorado is in the process of setting up paid family and medical leave for January of 2024. And until then,
not even everyone is protected by the unpaid Family FMLA, Family and Medical Leave Act from the federal level. So for instance, I actually have a 3-month-old. I just had a baby and my husband didn't have access to FMLA. I did, but I had to use the pay that I had accrued over time because I didn't have paid leave.
Nationally, it's over 80% of workers do not have access to paid family and medical leave.
In 2018, there were around 255,000 kids under 6 in Colorado with working parents in need of some kind of childcare.
We actually only had in 2018 enough slots, so licensed capacity, to serve about 148,000 kids, which is only 58% of those children under 6.
It likely only got worse during the pandemic and doesn't take into account affordability and if people are working outside business hours.
So seeing this exactly with Roe v. Wade, this decision was originally made decades ago, and we're seeing rollbacks on it. The same thing happens when we make these significant wins at the state or local level.
So the other thing to keep in mind when you're talking about access to health care and what happens if you've got more people looking for care when pregnant is maternal mortality. It's impacting more minority women as well. Foster said that too many new moms have been lost to suicide, drug overdoses, domestic violence, and for kids who are experiencing that, especially at a really young age, that can lead to higher rates of heart disease, depression, and a whole host of other health issues as well that would affect them long term. So again, the question is what do we have in place to help these moms? CDPHE is working on community collaborations, improving, healthcare access and making it more relatable and accessible for moms, especially our minority moms. But it's an issue here in Colorado that kind of mirrors what's happening across the country as well.
I feel like these are not the kinds of issues that there's a lot of denialism about. It's just how do you find workable solutions?
Exactly. And everyone I talked to said the state is trying to take these steps, right? They have passed laws to improve insurance. One of the things is Medicaid coverage for postpartum care that maybe wasn't there a couple of years ago for some of our moms. They also have opened up avenues to report issues with maternity care if it's not being done the right way. But again, they said these are steps, but we've got a long way to go in Colorado to really close that gap.
So we'll keep the conversation going. Anusha, thank you.